this video is called Drugs That Can Cause Dementia, Can Cause Cognitive Impairment. Here's a paper, if you want to look up a paper showing you this information. Drug-Induced Cognitive Impairment by Arnie Reimers. Okay, but this is pretty well-known stuff. And the point I'm making is, again, we're getting into this idea of synergistic toxicities. Okay, these are all medicines that are well known to cause cognitive impairment. And the real questions are, how high is the risk of cognitive impairment? How rapidly does it come on? Is it reversible? Yes or no? How severe is it? Proton pump inhibitors can cause dementia. Statin drugs can cause dementia. All psychiatric medicines cause brain damage. There's no exceptions. You don't want to be messing around with psych drugs. Psychiatry is the biggest fake overrated field in medicine. This includes tricyclic antidepressants, selective serotonin reuptake inhibitors, benzodiazepines, lithium, and antipsychotics. Okay, I would not take any of that stuff. Anti-seizure medications, they slow the person's brain down, lower IQ. Antihypertensive meds. The danger there is that they often run the pressure too low and the person's not getting enough blood supply to their brain. It's one of the most common reasons old people fall. And other drugs can get into that range. Things like the benign prostatic hypertrophy, BPH prostate, difficulty voiding. People take something like tamsulosin. Well, it's an alpha blocker, and that means it can also cause vasodilation of the arteries and hypotension, low blood pressure. And a lot of people can fall from that. I got internal medicine docs saying they've seen lots of people falling from tamsulosin. Okay, what else? Antihistamines, Benadryl, okay, diphenhydramine, sleeping pills like Ambien, Zolpidem, things like that, Lunesta, fluoroquinolone antibiotics. They stick a fluoride on stuff to make it less polar to get it across the blood-brain barrier. And these are just known drugs that are prescribed for people. There's tons of toxins with fluoride combined to them that make them more toxic to the brain. Anti-herpes medications like acyclovir, corticosteroids, anti-Parkinson syndrome drugs, okay, some of those, okay. Opioids, marijuana, alcohol, cocaine, general anesthetics. Any stimulant is over time going to be dangerous. Those attention deficit medications. NSAIDs potentially. Chemotherapy, big time. Chemobrain. Some of the IBS drugs can cause cognitive decline. Overactive bladder drugs like oxybutynin. Many of the mitochondrial inhibitors. I'm like the world expert on mitochondrial inhibitors. I found over 120 of them. And I've given separate lectures on that. I got a good lecture over at VegSource if you want to see on mitochondrial inhibitors. I got a bunch of lectures on mitochondrial inhibitors on this channel too. But the point I wanted to make is lots of people are on multiple of these medications. They're eating mitochondrial inhibitors in their food. They're drinking them in their unfiltered water. Once you understand this, they've got silver fillings in their mouth with mercury. They're like 50% mercury. And they're swallowing it. They're inhaling it when it outgasses. So all these simultaneous brain toxins are slowly lowering their cognitive function, and they need to try to figure them out and avoid them before they get to the point where their cognitive function is so low they can't turn it around. So just giving you a sense of this, And if you got an old person in your family, you want to help them, go through their medication list and talk with their doctor. Do they really need to be on all these pills? Work with them on their diet, filter their water, go for exercise, get some sunshine, get to sleep.